High blood pressure is often called the silent danger because it causes no symptoms for a long time, yet it can damage the body in serious ways. Many people don't even know their blood pressure is too high. While a person feels completely normal, the heart is forced to work harder every day. The blood vessels are under constant pressure, their walls become thicker and less flexible, and organs like the heart, brain, and kidneys must perform far beyond their normal limits. Over the years, this can lead to severe consequences: heart attacks, strokes, kidney damage, or vision problems. High blood pressure develops for many reasons: stress, excess weight, lack of exercise, genetic factors, or simply aging. That's why it is so important to check your blood pressure regularly, even when you feel healthy. Modern devices, apps, and AI-supported systems help monitor values more accurately and detect changes earlier. High blood pressure is dangerous, but it is treatable if it is discovered in time. High blood pressure does not appear overnight. It develops slowly, often over many years. The pressure in the blood vessels rises because the heart must pump harder to move blood through the body. This can have many causes: stress, lack of exercise, too much salt, excess weight, smoking, or genetic factors. Age also plays a major role, as blood vessels lose elasticity over time. The problem is that most people feel nothing. No pain, no warning signs, no visible changes. The body adapts to the higher pressure without sending an alarm. This is what makes high blood pressure so dangerous. While people go about their daily lives, the heart and blood vessels are working under constant strain. The artery walls become thicker, deposits can form, and the risk of heart attack or stroke increases. Modern AI systems help identify patterns in blood pressure readings that are easy to overlook. But the most important step remains: checking your blood pressure regularly, even when you feel healthy. High blood pressure acts like a constant internal force that slowly but steadily damages the body. The heart must work harder to push blood through vessels that are under increased resistance. As a result, the heart muscle becomes thicker, especially the left ventricle. What first appears to be an adaptation eventually becomes a burden. The heart becomes stiffer, less efficient, and may no longer pump enough blood through the body. The blood vessels also suffer. The high pressure damages the inner walls of the arteries, causing tiny tears where fats and calcium can accumulate. This leads to arteriosclerosis and narrowing of the vessels, significantly increasing the risk of heart attack and stroke. The kidneys are also affected because they filter the blood, and the higher the pressure, the more their delicate structures are damaged. Most people feel none of this until serious problems appear. This is what makes high blood pressure so dangerous. It works silently, day after day. High blood pressure is deceptive because it often causes no clear symptoms for a long time. Many people feel completely healthy even though the pressure inside their body is already dangerously high. Still, there are signs that should not be ignored. These include recurring headaches, especially in the morning, dizziness, ringing in the ears, inner restlessness, or a feeling of pressure in the head. Some people experience heart palpitations, shortness of breath during exertion, or a flushed, warm face. But these symptoms are vague and can have many causes. This is why high blood pressure is so often overlooked. The body adapts to the increased pressure, and most people notice nothing until damage has already occurred. It becomes especially dangerous when sudden severe headaches, vision problems, chest pain, or shortness of breath appear. These can be warning signs of a hypertensive crisis. Modern measuring devices and AI-supported analysis help detect irregular patterns early. But the most important rule remains: only regular measurements reveal the true state of your blood pressure. When high blood pressure is ignored for years, it can cause damage throughout the body that often goes unnoticed until it becomes serious. The constant pressure forces the heart to work harder, causing it to enlarge and eventually lose its ability to pump enough blood. This can lead to heart failure, which shows up as shortness of breath, fatigue, and fluid retention. The blood vessels also suffer. They become stiff, narrow, and more prone to tearing. As a result, the risk of heart attack and stroke increases significantly. A stroke is especially dangerous because it can damage the brain within seconds. The kidneys are also affected. Their delicate filtering structures are gradually destroyed by the high pressure, which can eventually lead to kidney failure. Many people feel nothing until severe symptoms suddenly appear. This is what makes high blood pressure so dangerous. It works silently in the background, day after day, causing damage you cannot feel until it is too late. When high blood pressure remains unnoticed for many years, it can cause severe damage to blood vessels that sometimes can only be treated with medical procedures. One of the most common interventions is placing a stent. This small metal mesh is inserted into a narrowed or damaged artery to keep it open and allow blood to flow freely again. In the coronary arteries, a stent can be life-saving. But sometimes this is not enough. If high pressure causes a vessel wall to bulge, known as an aneurysm, there is a risk that the vessel may rupture. In such cases, the damaged section must be replaced or reinforced. Surgeons often remove a healthy vein from the leg and use it as a new blood vessel. For larger aneurysms, an artificial vascular graft may be used, a strong protective tube that stabilizes the weakened area. These procedures are complex and not without risk. They show how important it is to detect high blood pressure early, before such drastic measures become necessary. Artificial intelligence is becoming increasingly important in medicine, especially for conditions like high blood pressure, which often remain unnoticed for years. Modern AI systems can not only measure blood pressure but also detect patterns that are almost invisible to the human eye. They analyze fluctuations over days, weeks, or months and warn early when a dangerous trend begins to develop. Many people already use smartwatches or apps that record blood pressure regularly. AI compares these readings with millions of other measurements and identifies whether a risk is emerging. In hospitals, AI helps detect vessel narrowings or aneurysms on medical images, often earlier than a human could. It supports doctors in deciding whether a stent is needed or whether an aneurysm must be reinforced. AI does not replace medical treatment, but it makes it safer. It identifies warning signs before it is too late and gives people the chance to act in time. High blood pressure often goes unnoticed, yet it can cause serious damage inside the body. This film aimed to show how important it is to take early warning signs seriously and monitor your blood pressure regularly. By subscribing to this channel, you won't miss any new medical films and you'll always stay informed about upcoming topics. Medicine and AI are evolving quickly, and we keep you updated. Thank you for watching, and stay healthy.